Even a little weight loss is a very big deal metabolically. Obesity is associated with a lot of conditions: non-alcoholic fatty liver disease, lipid problems, cholesterol problems, high blood pressure, insulin resistance, beta cell dysfunction, type 2 diabetes, and coronary heart disease, and stroke. The number one killer, the number one disabler. So with the new year, many people do have plans to lose weight. Starting a program can be tough, not to mention being able to finally shed some significant weight. That's difficult as well, but don't worry so much about significant weight. Don't worry about 40 pounds, 150 pounds. Let's just start with 5 to 10 pounds. Even that alone makes a big difference. Losing a little weight will go a long way. Let's check the unexpected benefits. Here you go. The first is a study in cell metabolism in 2016 featuring 40 men and women. The mean average age was 44. They were sedentary, less than 2 hours of exercise per week. And exercise there was even just walking. They were obese. The mean BMI was 37.9. They took 2 groups. 20 subjects in the weight loss group were required to lose 5% of their weight. 20 were in the weight maintenance group. Both groups participated in a lifestyle intervention program, including some dietary changes. The markers measured were body composition, or BMI, blood pressure, heart rate, oral glucose tolerance tests. So this is a good test in terms of evidence of the true metabolism, what's going on. Adipose tissue markers of inflammation. So again, they're not just taking blood pressure, they're focusing on some laboratory drivers of metabolic problems. The results: all subjects were able to achieve a 5% weight loss by consuming a low-calorie diet, self-prepared foods. The weight loss subjects achieved an 11 to 16% weight loss with solid and liquid meal replacements. Shedding just 5% of body weight was enough to improve the beta cell function. And I can tell you, I see that all day, every day. Multi-organ sensitivity to insulin, the muscles, the liver, much better OGTT numbers, which again impacts cholesterol numbers, it impacts heart attack and stroke risk, all those things down the line. An additional 11 to 16% weight loss further improved beta cell function and insulin sensitivity. It also caused stepwise changes in total body, visceral, and liver fats. So here's another study, the Norfolk Diabetes Prevention Study. It's a parallel 3-arm group-based randomized clinical trial conducted with up to 46 months of follow-up in August 11 to January 19. It's the largest diabetes prevention research study globally in the past 30 years. It was in JAMA of November of last year. 12,778 people were first screened. 1,000 high-risk individuals with mean age of 65 were then selected based on the following conditions: elevated blood sugar, fasting blood sugar, 110 to 126. Elevated A1C, 6 to 6.5, with elevated fasting blood sugar of 1 to 110. High-risk individuals went into different arms. The first one was a control arm receiving the usual care. The second was a theory-based lifestyle intervention arm of 6 core sessions and up to 15 maintenance sessions. Number 3, the same intervention as number 2, with support from diabetes prevention educators, trained volunteers with type 2 diabetes. The markers were BMI, weight, and blood glucose levels. The findings: you lose 4.5 to 5.5 pounds of weight and increase physical activity. That supports healthy blood sugar levels for pre-diabetics. Again, not as good in terms of the science and the outcome and the evidence in that they didn't get a full OGTT, they didn't get some of these inflammatory markers, but you knew from looking at fasting glucose. Population-wide, we're getting significant improvement. Other benefits: dropping as little as 10% of the body weight lowers the cholesterol, which we know now has a lot to do with that blood sugar. Lowers insulin, C-reactive protein, the inflammatory numbers, lowers the triglycerides, triglyceride over HDL ratio. That's the most important ratio when you first look at a cholesterol problem. Losing 6 pounds is enough to decrease inflammation and enhance immune functions. That was in a 2015 study. Of weight leads to better sleep and improved moods. 2014 press release from the Endocrine Society. Shedding 5 to 10% of weight leads to higher scores in terms of physical function. Self-esteem, a 2009 study. Losing 11 pounds can decrease chances of osteoarthritis, a Johns Hopkins Arthritis Center study. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.